It's good and bad news this week for patients in the Lostwithiel area of Cornwall. A dental surgery has been struggling to maintain NHS services, but a new pilot scheme's been launched, believed to be one of the first of its kind in the country, to try to improve things. So NHS services will now be available to children under 18, patients over 80 and some vulnerable patients. Emergency dental care will also be available. The change, though, will impact around 4,500 patients who will now have the option to stay on a private basis or join another dentist. As Tamsin Melva reports, those behind the pilot say it's designed to focus on those with the greatest need.
In January, Finn Basson, who's been an NHS dentist for 26 years, went to Jordan with a dental aid charity to work for 10 days.
What it made me realise is that the dental health of a lot of people who can't get access to dentists in our county, in our region, was worse than the refugees that we were treating. So I really felt that when I came back, this budget that I had to be used in a way to meet those people's needs.
Struggling with a national contract for NHS work that pays by units rather than the work done, Finn took advantage of now being able to work with the NHS locally to redo the contract here, targeting those most in need.
We really need to spend this money for the benefit of everybody, and it's regretful, but it's something that has to happen.
I just despair. Everything is falling apart. Been depleted for too many years.
Focusing on under 18s and over 80s, though, means around 4,500 patients like Janet will lose their access to an NHS dentist at the practice.
We're in a poor county. So many people are struggling to live, and going to the dentist will not be a priority.
The alternative was everybody losing their NHS treatment here. And what we're going to get here now is that the space that's created by taking some of those working age adults off the list will be able to reach out to hundreds or even thousands of people who've currently got no NHS or private care at all, who are in real need, that they will be able to start getting treated for the first time. But overall, the system nationally is in a complete mess.
A spokesperson for the Department for Health and Social Care told us that more than £3 billion worth of NHS dentistry is funded a year, and that progress is being made to boost NHS dental services, with the number of children and adults receiving NHS care going up.
So this is a pilot we're going to be watching really closely, but if it looks like it's working, and that's obviously the hope, that we will see and welcome people who want to roll it out elsewhere.
Patients like Janet now face a search for another dentist or going private. But it's a solution those involved say is for the good of a whole community in a complex and very challenging environment. Tamsin Melva, BBC Spotlight, Lostwithiel.